Hello everyone, my name is McKerihan, and I'm a nurse practitioner for a large rheumatology practice in the Charleston, South Carolina area. My title is Director of Infusion Services. Our practice has 3 offices spread throughout our metro area. And I just wanted to tell you a little bit about what we're doing in our office and in our setting to keep our patients and our staff safe during this COVID crisis. We took the decision and decided to close one of our offices. We closed our smallest one because it was going to be the hardest one to keep and maintain social distance. So we closed that office. That's allowed us to have more people working from home. In our other 2 offices, our physicians are doing telemedicine. They are coming into the office and doing it there. Some of their MAs and medical assistants are working from home, and some are working from the office. They take turns doing that. In the infusion area, we have done social distancing. Our waiting chairs are at least 6 feet apart. We have one nurse who is pregnant working from home, and she is actually going through the charts the day before and looking and doing our normal screening that we do in preparation for the next day. But she is also calling all of our infusion patients the day before and screening them with the COVID questions. She also does a lot of question answering. If she is not able to answer questions, or if patients call with questions, they're often punted to me. And in my role as a nurse practitioner, I'm doing a lot of reassuring of our patients and of my staff that we are indeed following the latest guidelines from the CDC. I've worked closely with our Chief Operating Officer and with our CEO and with our physicians to make sure that we are current on the guidelines from the CDC, from the ACR, and from other organizations such as NICA to make sure that we are following the best practices in our infusion areas. Our chairs in the infusion room have been separated to 6 feet apart, which means we've had to remove a few chairs. However, we have managed to pretty much stay up with all of our infusions that we're doing, and with very few patients unable to get infused. We do screen patients prior to them coming into the office. They are met at the door, their temperature is taken, and the COVID screening questions are asked. Following that, they come back to the infusion area and we pull them back into the room as soon as possible. We've done a few things to change and eliminate how much we touch the patients and how close we get to them. We are not taking vital signs as frequently. We are trying to have one nurse work with one patient, although that's not always possible because in our larger infusion room, we are very busy. We also screen our patients prior to their infusion, make sure that they don't have any infections, no fevers, no cough, all those typical things that we ask them along with the COVID questions. We just last week started wearing masks, particularly when we're going to be in close contact with our patients, starting IVs and so on. We are not able to provide masks for our patients, but many of them are coming in with their own masks. They've made them, they're wearing scarves, they're doing ingenious things with various items that they find around their house. But we are infusing our patients. My nurses work well together. I'm so proud of how well they're working. I'm so proud of how well our insurance people are working from home and answering questions with these patients and making sure that we are still okay to infuse from an insurance perspective. It's just been really encouraging to me to see how well people come together and work to make sure that we are providing safe and timely care for our patients. I'm sure that there are many stories out there that you could tell me of how people are being inventive, ingenious, doing things that you never thought they would do in order to provide good care. We even had a patient come in with an instrument and he played for us. That was so much fun, and it just brought delight to everybody's eye, to everybody. So stay safe, work hard, be encouraging. I love hearing all the stories of how people are working out there and what they're doing during this time of crisis to stay safe and have fun. So good luck, and I look forward to seeing all of you at our national conference.